Welcome to Department of Anatomy, Faculty of Medical Sciences, University of Sajith. In this dissection series, we will try to identify the cross-section of the upper limb taken at the mid-forearm. In this forearm cross-section, you can clearly see there are two bones. One should be your radius and one should be the ulna. If you go through the other video that we have created for the cross-section of the leg, again you will find another two bones, tibia and the fibula. But in that particular video, we have clearly mentioned the large bone is the tibia, the smaller bone is the fibula. So that is how you will orientate yourself whether it is a cross section from your leg or from the upper limb. So in a leg you will find a larger bone, the tibia, the smaller bone as the fibula. Now in this cross section you will find the two bones which is almost similar in shape and the size. So let's try to orientate this particular specimen. So the cardinal identifying feature is this flexor digitorum profundus muscle. This flexor digitorum profundus muscle, which is covering almost the anterior aspect of your ulna and reaching almost the half of the ulna towards the posterior aspect. So this is your ulna bone. So since this is the ulna and this should be your radius. So now let's try to identify the anterior aspect of your forearm muscles. So this is your flexor digitorum profundus muscle. This is flexor carpi ulnaris muscle. And here you will find a large muscle bulk. This is your flexor digitorum superficialis muscle. If you pay clearly your attention to this whitish color appearance structure, this is the palmaris longus tendon. Now you can clearly see there are two blood vessels. So since we have identified this structure as the ulna, so this is your ulnar artery. This is your radius, this is your radial artery. Along with that, you can clearly see this is the brachioradialis muscle, slip-like muscle. Then when we try to identify the structures at the posterior compartment of the forearm, you can clearly see the extensor carpi ulnaris muscle because you have identified this as the ulna. So this is your extensor carpi ulnaris muscle. A small muscle that you can see here is the extensor pollicis longus. This is the intraosseous membrane which is running in between two bones. So along with the intraosseous membrane, the posterior compartment you can see abductor pollicis longus muscle. When you come to the most posterior aspect of your forearm, you can clearly see the extensor digiti minimi muscle, extensor digiti minimi muscle here. Now this muscle bulk is your extensor digitorum muscle. Now when you come for the lateral aspect, you can see there are two muscles here. So these are the extensor carpi radialis longus and the brevis. So this is how you will orientate a cross section of the forearm when it is given for your exams. Thank you very much.